How we doing YouTube? Nick Pratap here from Next Gen Rehab, and in today's video I'm going to be talking about the medication Warfarin and how it impacts exercise. Now with any medication video I do, this is not meant to be medical advice, so if you do have any specific medication related questions, please follow up with your family doctor. Now let's start this video off with talking about what Warfarin is. So Warfarin is a medication under the classification of anticoagulants, alright? So it's just a fancy term for blood thinner. So when is this medication administered? There's a few different situations. One would be if the patient has atrial fibrillation, so that's an irregular heart rhythm. And so if this is the case, then you're at an increased risk of forming clots in your body. If you can form clots in your body, you're at an increased risk of stroke. So you may be prescribed this medication. A second incident may be for individuals that have had heart valve surgery, and in particular they've had a valve replacement, and the valve that they've had replaced is a mechanical valve, or the valve that they've had replaced, the new valve is a mechanical valve. So this has a higher likelihood of clotting with this procedure, and so patients are prescribed warfarin for a period of time to reduce the chances of clots forming. Another situation might be something called deep vein thrombosis, where you develop clots within the legs that can circulate in the body and cause some issues as well. All right, so that may be another situation where you're prescribed warfarin. So in terms of being prescribed this medication, the whole purpose is to keep the blood thin, and now there is a fine line of how thin we want to keep it, right? So your doctor is going to send you for blood work every couple weeks, known as INR, okay? And this is just testing how thin your blood is getting. So they don't want it to get too thin, but again, they don't want it to go on the other end and be thick enough where clots can still form, right? So they're going to send you for this every couple weeks. If it's getting too thin, they're going to titrate your medication. If it's getting on the other end, blood's getting too thick, then they're going to go ahead and adjust the medication accordingly, all right? So again, blood getting too thick, meaning it has a higher susceptibility of clotting. So that's something that your doctor will be doing for you as well. When it comes to interactions within the body, warfarin interacts with vitamin K, all right? So this is an issue or a situation to talk to your dietitian or healthcare provider about, because you want to continue a steady intake of vitamin K, but there may need to be some dietary changes because vitamin K is involved in regulating clotting in the body, and warfarin is involved in the opposite, right? Thinning your blood out. So if you go ahead and have this crazy consumption of vitamin K while being on this medication, you're going to potentially increase your risk of clots forming in the body. So generally speaking, you can maintain a steady stream of consuming vitamin K, but because you are taking this new medication, I would advise you to speak with a dietitian or your healthcare provider if there needs to be any nutritional changes made based on you taking this medication. All right. What are some of the bigger side effects with taking warfarin? So warfarin basically, the big one is internal bleeding, right? So you have an increased risk of internal bleeding, GI tract bleeding. You may, if you feel any or see any blood in your stool, or you feel any abdominal pain or discomfort, that's a situation where you should be following up with your family doctor, all right? Another one that we may see in the clinic is bruising that's kind of come on with kind of no apparent reason, right? You might have just gently bumped your elbow, but because you're on this anticoagulant medication, you're noticing bruising happening a little bit more easily. So another thing to look out for. Again, if you ever have any concerns with side effects from this medication, definitely follow up with your family doctor. And lastly, how does it impact exercise? Now, in terms of exercise and exercise prescription in general, there's no real contraindications with exercise. The big one though is because you're at a higher risk of internal bleeding, certain contact sports, right? If you're playing things like football, you know, doing martial arts, maybe skiing, mountain biking, sports that are higher impact, or you can have a fall. For example, if you take a fall off your bike, or you get hit too hard playing football and you're on this blood thinner, then you increase your susceptibility for internal bleeding, right? So there may need to have a conversation had there with your healthcare provider or your exercise physiologist to see what might be appropriate for you after starting this medication, and if there's higher risk activities that you should potentially be staying away from because of its risk of causing internal bleeding while being on warfarin. All right. So hopefully this video helped out. If you have any questions, feel free to leave them in the comment section below. If you have any future videos you would like to see, again, leave those in the comment section below as well. And once again, my name is Nick Pratap from Next Gen Rehab. We'll see you in the next video.